If you're anything like me, like learning anatomy through sports injuries, this is episode 79, and this is Virgil van Dijk, October 17th, 2020. So let's take a look at it. Everton, Liverpool, as Van Dijk is going to make a play on this ball, and the goalie makes a tackle on him, and he instantly grabs his knee. And as we know, athletes know their bodies pretty well. Let's take another look at it. Van Dijk's going to make a play on this ball. His foot's going to plant, and the goalkeeper, kind of scissors his knee, causing excessive valgus as well as extension at the knee. And that's not good if you are Virgil van Dijk. So let's check out what happened. So it was an ACL tear, a grade 3. We know that hyperextension injuries likely cause ACL tears, and that's exactly what this was. It was a valgus mechanism of injury as well as a hyperextension. Valgus, as we know, is knock-kneed is another name for it, where the knees go in together. And when that goalkeeper made that tackle, it forced a hyperextension as well as a valgus, and the ACL cannot handle both of those in extreme ways like they did here. So immediate swelling is likely to occur during an ACL injury. It's just like a telltale sign. Meniscus involvement, medial meniscus tear, I put a question mark because it wasn't really confirmed or not, but it's possible because the ACL, as we can see here, this big red one in the front, connects to the medial meniscus. So it has a bit of an attachment. So when that tears, it could rip the meniscus off of the bone. I don't think it happened here for Virgil van Dijk, but nonetheless possible. Joint line tenderness is one of the ways to rule in a meniscus tear. So you can feel the joint line or on the outside or inside of that knee. And if it's tender, it could possibly have a meniscus tear. Also possible MCL sprain just because of the valgus. So when you go into a valgus in a knock-knee position, you got to think of these bones coming apart. The femoral condyle and the tibial condyle are coming apart, stretching that MCL. Bone bruise on the lateral condyles, that is the lateral femoral condyle. So that's just caused by those two basically slamming into each other. So what did they do? Well, they did an on-field evaluation, anterior drawer test, Lockman's test, and pivot shift test. This picture, I think, is the end of a pivot shift. So the pivot shift, basically, when you have the knee in a flex position and then you pull it into an extension, and if that knee clunks down, that is a positive test for a pivot shift. So a little bit of a physio breakdown today. Didn't think we'd be having one of those, did you? But here we are. He walked off the pitch, actually, and was able to get off on his own power, but he did have that full ACL tear. So the MRI confirmed that. He had surgery, ACL reconstruction, where they did an autograft, used his hamstring tendon to replace that ACL. He had a 9-month rehab, obviously, early range of motion. You want to emphasize extension because that helps with the gait cycle. Quad activation using NMES or BFR, and he's still playing for Liverpool today. As you can see, he's got a 96 on FIFA, so he's pretty good. So that is Virgil van Dijk.